It's actually quite simple. If we look at the countries across the world, the countries that responded quickly, got in at the very beginning, are the ones that have managed to contain the epidemic. Now, of course, beyond that, there are a whole range of things as to what they actually did. But if we look at the rate of transmission of this virus, and let's say we typically think in every one person infects between 2.5 and 3 other people. Say they do that every day. Well, then in one day they'll infect 3, then 9, then 27, and then it goes up to about 20,000 in a matter of about 10 days. That's the challenge. If you can get the transmission number down, the R number down, get it down to, say, 1.5, then you can reduce that number from 20,000 additional cases down to about 40. So even a few days makes a huge difference. Well, at the very beginning, the World Health Organization said test, test, test. The United Kingdom was not in a position to do that. It had its public health infrastructure had been weakened. I think it's pretty obvious to say that the government has had other things in its mind for the last 4 years, and it did have a major exercise in emergency planning in 2016, but though that the results of that have never been released, but we do know that some of them were not acted upon. So I think there was a sense of there are lots of things we would like to do, and that was conceded at a parliamentary committee hearing yesterday by one of those who was giving evidence that, in an ideal circumstances, we would have done a lot of other things, but we recognised that we didn't have the capacity to do it.
In other countries that have been similarly hit, so Italy and Spain, they've just recently started to loosen the restrictions in the country. The UK haven't published any formal sort of exit strategy. They're keeping that quite guarded. To what extent do you think that they're looking towards Italy, Spain, to see what happens there, to wait and watch before making a move?
Well, I'd like to think that they are. Now, of course, we still are behind the curve of Italy and Spain. We probably have passed the peak of hospital deaths, but not of deaths in care homes. One of the problems we've had is that throughout this, we've only been counting deaths in hospitals and ignoring the deaths in care homes. That has now changed, and now we're adding those figures in. We can see that essentially we've got 2 epidemics. So it is a bit premature to be thinking too much about that. But that said, there is a very clear set of guidelines from the European Union about the steps that need to be taken, and they're pretty straightforward. Essentially, we have to keep that R number down below 1. Get it below 1. We have it below 1 at the minute, but keep it below 1, and then test every easing of restriction that we have against that to say, is that going to take it up a bit? If so, do we need to compensate with something else, like wearing face coverings, for example? What forms of social distancing do we need? But you're right, we haven't yet seen that, and it would be helpful at least to have some general indication, but it has to be driven by the epidemiology. First thing you need to do is to make sure that you have all of the intelligence, all of the information that you need, and that means having an appropriate testing scheme in place. Now, unfortunately, in the UK, the debate has been fixated on the number of tests being done and not what those tests are being done for. So I and others have been saying that we need a list of questions that need answers, and then we need to say, what does this particular part of the testing program tell us? Which questions does it answer? We need to know much more about the levels of immunity in the population. We need to know much more about how it is spreading, and in particular, how it is spreading in care homes and what we call these institutional amplifiers. It was the cruise ships at the beginning. In some countries, it's been prisons. We need to understand that. And I don't think we're anywhere, we're not there yet in terms of having the testing and tracing program in place. And I think a number of worries that we do tend to be going our own way, for example, with an app which is different from the one that's being used in other countries and which is being tried and tested. We're not making use of the local expertise in the public health departments in local government. And in a way, it's this sort of central vertical program of the sorts that have been used in low-income countries, parachuted in, and unfortunately, they haven't worked in the past.